Hi everyone! Today we will be sharing the research we've conducted for our evidence-based project on pressure ulcer care and recovery. First, let's meet the team. My name is Cynthia Nugent and I'll be discussing background information, clinical significance of our PICO, and usage of search strategies.
I'm Ariel Victor and I'll be discussing the inclusion and exclusion criteria as well as the key findings from our research.
I'm Haley and I'll be discussing the strengths of the literature collected.
Hi, my name is Jasmine and I will be discussing the weaknesses of our literature.
My name is Blessing Nowok, and in this presentation, I will be discussing the types of research studies, participants, and intervention.
Hi, my name is Elizabeth Lipsky, and I'll be covering the rationale for recommendation and implications for practice life.
So let's begin by talking about the background information on pressure ulcers. What is a pressure ulcer? A pressure ulcer, also referred to as bed sores or decubitus ulcers, are injuries to the skin and the underlying tissue that result from prolonged pressure on that part of the skin. They mostly develop on the bony prominences. This can include, but is not limited to, the occiput, trochanter, sacrum, malleoli, and heel. The severity of a pressure ulcer is assessed in the healthcare field using a numeric grading scale, with grade 1 being the least severe and grade 4 being the most severe. Following the image to your right, you can compare that to the stages listed to determine the level of severity of a pressure ulcer. Now let's talk about risk factors. A risk factor is a variable associated with an increased risk of developing a disease. The risk factors for developing a pressure ulcer is being bed or chair bound, difficulty with ambulation, excessive moisture and fecal incontinence, low body mass index, changes in weight, reduced food intake, inability to eat independently, skin changes, altered level of consciousness, friction shear, and poor perfusion. The image on your right categorizes these factors based on if they are extrinsic factors, meaning that they're influences from the outside such as the environment or lifestyle, or if they're intrinsic factors, which are influences based on the individual's pathological and genetic characteristics. Some facts about pressure ulcers are that they are a common recurring problem in the inpatient hospital setting and can be seen across a wide range of age groups and populations. Based on the research conducted by Voci, Fontes, and Abate in 2018, the hospitalized pediatric population's bedridden patients were labeled as high risk for developing a pressure ulcer due to immobility. In 2019, Yap et al.'s research published that $11 billion is spent annually in the U.S. healthcare system on pressure ulcer treatment, and the cost increases based on severity of pressure ulcers as stated by Meddings et al. In 2015. The problem we are currently facing is that a large amount of money is being spent on treating existing pressure ulcers, and insurance does not cover the cost of treatment for patients that develop a pressure injury during their hospital stay. My team believes that through the use of proper nutrition, the body can receive the resources it needs to heal and pressure injuries can be improved significantly. Let's look at the breakdown of our research question. The population we will be focusing on is various hospitalized patients. We will be looking at several populations groups ranging from the older adult to pediatric group. Our intervention is nutrition. We want to evaluate the impacts of nutrition on the healing process. What types of nutrition help aid wound healing? Is there a specific diet that is currently working? The outcome we hope for is that patients with pressure ulcers will experience positive wound healing after implementing a proper nutritional diet. The question we formulated is, does nutrition influence wound healing in hospitalized patients suffering from pressure ulcers? Let's take a look at the search strategies that we used to find literature that would be supportive of our evidence-based practice. Our search strategies consist of using Boolean operators such as AND to delimit our search and OR to expand our search. Important keywords we used were pressure ulcers, pressure injuries, bed sores, decubitus ulcer, pressure damage, pressure sore, nutrition, diet, nutritional status, food intake, and nutritional intervention. And we did multiple searches on a wide range of databases like Sinal, Medline, Towson Cook OneSearch, and Google Scholar to gather our research data.
The articles included in this review were all peer-reviewed articles published within the last 5 years and consisted of qualitative, quantitative, and mixed method studies. Articles excluded from the review were written before 2015 and were systematic reviewed articles.
The strengths of the literature collected was first that all of the studies were peer-reviewed and published after 2015. This was to ensure that the information collected was evidence-based and congruent with the current best practices. Second, the data presented in the studies were all found to be statistically significant, allowing sound conclusions to be drawn from the research and integrated into current plans of care. The third strength of the literature was that there was a wide variety of specific nutritional interventions being studied, thus allowing us to generalize that nutrition as a whole aids the healing process of the pressure ulcer. And finally, with how different the populations were of each study, our conclusions could be reasonably applied to the general population of hospitalized patients.
When completing our literature search, in order to assess the quality of our articles, each one was analyzed using the CASP checklist. During this process, we discovered some weaknesses within our articles, which are listed here. Overall, our topic did not have many current studies, as well as few focused on nutrition-based prevention of pressure ulcers. Sample sizes was also an issue because this makes the studies not as reliable. Even with statistically significant data, it is harder to apply the results to the general patient population. One of our studies had bias present, and the length of the studies were short.
After reviewing the articles, we found that adequate nutritional status accelerates the healing of pressure injuries. Dietary supplements, specifically those containing collagen, aids in pressure ulcer healing. We also saw that education, along with nutritional interventions, decrease incidence of pressure injuries. The use of honey dressings and increasing protein, vitamin, and mineral intake was also seen to improve pressure injury healing. Malnutrition and low albumin levels were shown to increase the likelihood of pressure ulcer formation.
For the following 4 slides, I will be discussing the types of studies, participants, and interventions our articles used. For our first and second article, they were both case studies. For the third article, it was a quasi-experiment. For the fourth article, it was a prospective study. For a fifth article, it was a cluster randomized trial. And for our sixth article, it was a randomized controlled study. For this next slide, I will be discussing the participants used for our 6 articles. For our first article, there was one elderly 85-year-old malnourished woman with a pressure ulcer. For our second article, there was a pre-intervention sample of 197 patients and a post-intervention sample of 560 patients. For our third article, there's a study of 471 adult inpatients treated at a local university hospital. For our fourth article, there were 40 check home care clients over the age of 65 with non-healing wounds. For our fifth article, there were 1,600 hospitalized patients. And for the last article, there were adult patients with pressure ulcers from 22 facilities in Japan. This next slide discusses the intervention used by the following articles. For the first article, the intervention used was to treat pressure injuries with the use of Sumera RKS extract granules. For the second article, the intervention used was to educate the nurses on pressure injuries, turning patients every 2 hours, and ordering nutrition consults for patients with a Braden scale below 16. For the third article, the intervention used was to increase protein from 1.25 grams to 1.5 grams for individuals at moderate to high risk for delayed healing. For the fourth article, the intervention used was to apply either a honey dressing, povidone iodine, nanocrystalline silver, or hydrogel to the pressure injuries. For the fifth article, intervention used was to use the pressure ulcer prevention bundle consisting of 8 items including involvement and education of risk and skin assessment, skincare, nutrition, activity, support, and incontinence management. For our last article, the intervention used was to ingest a collagen-containing dietary supplement to help treat the patient's pressure ulcers.
Based on our findings, there are no specific nutritional guidelines that we can clinically recommend to help with healing pressure ulcers. During our research, we found that the topic of nutritional guidelines for ulcer care is understudied. No studies were found that said this specific diet plan will help with healing pressure ulcers, which is what our PICO question looked at. We all know about the DASH diet and its role to help lower blood pressure in hypertensive individuals, while for pressure ulcer healing, nothing like that has been studied or has been found. But what has been studied and what we mentioned in our key findings is that nutrition does, in fact, play a role in pressure ulcer healing. The rationale for our clinical recommendations, which you can see on the slide, is for the prevention of malnutrition. Because malnutrition is a key risk factor for the development and poor healing of pressure ulcers, which is something we want to avoid. In addition to implementing the pressure ulcer healing interventions we all know, such as wound care or certain dressings, healthcare providers can also make sure their patients are eating a well-balanced diet, and this will help with healing. It is a simple intervention. It does not have any side effects. You can see in our clinical recommendations that we recommend high-protein foods. A large amount of studies out there for nutritional guidelines recommend this. And a specific study that we had looked at for our research was a study that used different types of nutritional recommendations to look at patients and how they will heal, how their ulcers will heal. And one specific intervention was the implementation of high energy, high protein foods. And out of all the different interventions that they had tried, they found that that one was the best for pressure ulcer healing. Another big aspect of nutritional guidelines that is studied is supplements. But throughout our research, we did not find enough information, enough results for specific supplements for pressure ulcer healing. So the clinical recommendations that we do have are the ones that we were able to see in our research as evidence for pressure ulcer healing. So in conclusion, in the clinical setting, we want to heal pressure ulcers by preventing malnutrition and using these recommendations that we have found during our research.
That concludes the end of our presentation. Any questions? And here are our references.